Right. State legislators I talked to here say they still want to have some oversight over this to ensure that issues are being addressed as they come up. Dr. Mandy Cohen says, though, with so few doses coming here, the main challenge is trying to ensure that there's access across the state.
I've been waiting for that moment.
In the first weeks that people could start receiving the COVID-19 vaccine, Republican State Rep Ed Goodwin was worried by what he saw.
When we started off in Chowan County, it was a mess. My 96-year-old mother went to get a vaccine, and she sat in the car in line for 5.5 hours.
With the help of the National Guard in the northeastern part of the state, he said things got better by the time it was his turn.
I think we're getting the kinks out of it now.
After ranking among the slowest states to administer shots, Dr. Mandy Cohen said the state focused recently on speed. By the end of last week, the CDC said the state was 12th in the country for the rate of first doses administered to people. All of the first doses that providers in North Carolina received actually have gone to people. But that also came with concern, as some communities had their allocations cut. Is that coming at the expense of everybody getting a fair shot to get the vaccine across the state?
It is right to say we have to look at both speed and equity. And I think that's why our allocation process going forward, now that we've cleared any backlog, our allocation process going forward really is focused on both.
She says the state will get about 145,000 doses each week the next 3 weeks. 90,000 gets distributed based on county population, with the rest targeted toward areas with higher concentrations of people over 65, marginalized communities, and large vaccination events.
Fairness is the big point.
State Rep Robert Reeves says there's also pressure to get these vaccines out, given the more contagious variants of COVID-19 spreading.
We understand that they want to make sure it looks fair and that it is fair. But on the flip side, we've got to get doses out.
Dr. Cohen says demand among people who are currently eligible for the vaccine is still high because the supply is so limited. When the state does move into the next group, vaccinating frontline essential workers, they're not even going to be able to get to all of them in the first several weeks. State lawmakers here want to make sure when that does start, group 3, that those people don't experience the same issues people did when the rollout started. Live in Raleigh, Michael Hyland, Fox 46. Yeah.